Me to say I'm live. Welcome back to another podcast. Everything is public health, brought to you by Young Health Professionals. My name is Mr. Murray, and my other host is Dr. Linda Ray Murray. Today, we'll be talking about COVID and the effect on education for young people between kindergarten and 12th grade. We have some wonderful guests. First, we have Miss Smith, who's an educator. She does education and policy. She's also a parent. We have Brother Garcia, that's a teacher. He's also a parent. And my brother, Dr. David Stovall, who's a professor at UIC. So before we get started, we like to have a little fun. We just like to welcome people and open things up. I got to ask all three of you all, and this is very, very important. So I need an honest answer. And I'm going to start with you, Miss Smith. Cubs or Sox?
Ooh, I'm going to say both. I'm going to say both. Look, I know that's like it's the worst Chicago response, but it's the only one I got. I'm a fair weather sports fan.
So let me ask you this. I'm going to be more specific. You got tickets to a game on the same night. Which game are you going to?
Okay. Yeah, Cubs. Don't hate me.
I love the Cubs. Brother Garcia, okay. What about you?
So I've been, born, raised for 40 years of my life on the South Side, and I am a diehard Cubs fan. It's generational. It runs in the family. It runs in the blood. So I'm a Cubs fan all the way.
Brother Dave.
Hey, man, look. My blood bleeds 35th and Shields. You know what it is.
Really?
It ain't even a question, bro. Look,
hey, we couldn't even go over there back in the day.
That's real. That's real. But look, here's the other part of that. So y'all remember Mama Pat, who used to be with the Afro-American Patrolmen's League.
Yes.
She used to tell me this story. So look, Murray, Ernie Banks used to live around us because he couldn't live in Wrigleyville. They used to be on the Cottage Grove bus with Ernie Banks going to a game. So I was just like, man, look, I'm good. Like I know the Bridgeport situation, but we had Wentworth right around the corner, so I wasn't tripping too hard, right?
You also had a viaduct separating.
Right, so we knew what it was. So if they had to get down, they knew they wasn't coming across the Ryan. So that yeah, man. So my life is on 35th and Shields. I know what it is.
I'm not a Chicagoan. I know Mark doesn't want to answer you. But growing up as a Cleveland Indians fan, I could only go up, right? It's just like you say, living on the south side of Chicago, I am a Sox fan, and I consider one of my many parental failures is that I raised a Cubs fan. I don't know how that
happened. The Cubs had black players back in the 70s. They had Ernie Banks, Fergus Jenkins. So, that's what I was rocking with, man. That's what I was rocking with. So, today's topic is a very interesting one, being educators and parents and just regular people, citizens of this country. How do we feel about COVID as it affects our education system, and what are we going to do? So, Doc, Murray, can you give us an update, just on some COVID updates on what's going on?
Oh, sure. Just very, very quickly. We're over 5 million people in the United States with cases, and our deaths are over 175,000. But let me speak more directly to COVID-19. This is much, much worse than influenza flu that we get every year, which kills between 30 and 50,000 people in our country every single year. This particular virus, when we say it's a novel virus, that means it's new to us as human beings. It's passed very easily, much more easily than flu. That's why if you sit down at a table at a restaurant and have dinner with someone, you could easily become infected. So this is easily spread through the air. We know now there's a lot of debates and stuff, but we know now children can get infected and they can spread the disease. Also, even though many of our children, I want to be clear and serious about this, children can get very sick from the disease and they can die from the disease. But if you look at it proportionally over many hundreds of thousands of children, fewer children get seriously sick and require hospitalization. So the biggest problem we have is that if you're a public health person like me, you can say something nice and glib. Oh, 1 in 1,000 children get sick. But if you're a parent, what you want to know is my baby going to get sick? That's what you want to know. So that's the dilemma that we have. I know, and I know we're concentrating on K-12, but I'm sure some college stuff will creep in. As you can see in the newspaper, all around the country, colleges have had different approaches. And many of the colleges that tried to open up reasonably with precautions have had to close back down or go back to remote teaching. So we really don't know what's going to happen if we try to go through the fall with influenza and schools in person. It's going to be a big mystery. We'll have to watch and see.
So before we jump right into, I need some clarity on what you said. You said children can remain, for the most part, healthy, even though they have symptoms, right?
Children are less likely to have symptoms from this particular virus. So let me frame this differently. If you take 100 adults, and I'm gonna be honest with you, we don't know these numbers exactly. If you take 100 adults, we know a bunch of them won't have any symptoms and they'll still pass on the disease. But let's pretend this is a hypothetical. Let's pretend 80 of the adults actually get some symptoms, even though they may be mild. With 100 children, it might be 20 children get some symptoms. So the number of children that get sick with symptoms and how serious the symptoms are much less.
What about transmitting it, transferring it to adults?
From what we know now, they can transmit it to adults and to each other. More importantly, and to each other. So and you can't predict right now. We can't predict who's going to get very sick and who's not. So this is the question. If you have a classroom with 40 children in it, and one of them is COVID positive, and you may not even realize it, they can infect their other classmates. And those classmates go home. They take the bus home, they go home, they stay with grandma, at first, they visit auntie, they play with their cousins. And so one of our big concerns is how big a role do young children, elementary school children, play in spreading this disease? We know they play a big role with influenza, for example.
So let me start off with asking you a question, Dr. Smith. Ms. Smith, how you feel about this quote? I saw something the other day that said, we'll let criminals out of jail, but we want to send our babies back to school. How does that make you feel? And feel free, brothers, to jump in, but Ms. Smith, from like a policy standpoint, what does that say to you?
Well, I think it depends on your perspective as to whether you should create policy for the protection of the least in society, right? And or the most vulnerable in society. And I think that what I think as a parent, as someone who is in CPS schools, as someone who, is in a rare position where I can see all sides of the spectrum, I think that we're forced to assume goodwill by all actors. I think that if you don't assume goodwill, you will be enraged, right? Because you're talking about any given family's most precious commodity, which is their children, right? That being said, I think that having seen how CPS is preparing for this and having seen how private schools are preparing for this, I feel like at the end of the day, parents are simply choosing between safety and sanity, right? And I don't think that I'm very cautious to pass judgment on how a given family values the risk that they're willing to negotiate with what they believe is the social emotional cost of their child not being at school, because I feel like it's different. And I feel like it's different for every parent, right? I feel like parents are also negotiating the social emotional cost of bearing the burden of being the primary caregiver and teacher. But I'm not for sure if at this point I have seen any institution get it perfect, and perhaps that's a very high bar, right? Considering the circumstances that we're living in. So I'm not for sure if I quite answered the question, but I think we're forced to assume goodwill, but I also think that parents are weighing between two really bad options at the end of the day. And they're most parents are only doing their best, right? They're making the best calculations that they can given the information.
You said something interesting. You said you see a difference between Chicago public schools and private schools. And Brother Garcia, feel free to jump in. What do you mean by that? What difference have you seen or heard about?
Whew, that's a loaded question. It's a lot there.
It is that is definitely, if you don't mind.
Jump on this. The conversation, man. We family on here.
So yes, I'm a public school teacher, high school, right? But I'm also sit on the executive board of my union local, and we're part of the 571 of the IFT, and so the reason why Ms. Smith is correct, it is a loaded question, is because you've got unionized and non-unionized workers here, and so what does that mean, right? That basically means that as a union, you have a say at the table. You know, it's not top down. The administration can put out whatever statement they want, but in the end, they got to bargain with the union as far as, you know, how things are going to run. It has to be negotiated. There has to be a compromise. And with the private schools, the private institutions, whether it's Catholic or non-religious but private, there is no such thing. It is the admin's right, okay, to dictate how it's going to be, and everyone else has to adjust. So there is a big difference there when you're asking, you know, how things are going to be run between the two institutions.
Is there a difference in terms of one is better or one is not up to par? Is the learning process harder in terms of the distance, you know, through the internet, through virtual?
So, from my own personal experience, and again, I think it's important to extend a lot of grace to what people experienced in the spring. During the spring, when we received word that the students would be going remote from CPS, we received a 2-week packet, and there was no communication from our teacher. We went on spring break, and then once spring break adjourned, or once students were back in school, there was structure in place insofar as that there were platforms in place for students to tap into to get assignments. However, there was no group instruction. Actually, there was group instruction with the science class once a week, but that started in May. And it left a lot to be desired, if I'm being honest. However, again, because I believe in extending grace, what I will say is that for my CPS experience, my child was in pre-primary. He was in kindergarten. And how do you promote distance learning in pre-primary? It's a conundrum for everyone. I know people who had students who were in pre-primary in private schools, and there was no interaction because, again, how do you facilitate a remote learning experience for kindergartners? I think it really genuinely creates a barrier, regardless of what the school system is. However, just to speak specifically to how I interacted with CPS during spring, with all that information, it just left a lot to be desired. In contrast, with the private school experience, although it's much smaller, and although these teachers get paid literally half as much from day one of remote learning, the teachers were saying, you know what, let's have a Zoom just to touch base. Let me see your face. Let's talk to each other. And I think that social emotional check-in was present throughout the school year, even if the structure of the private school experience evolved, right? And I will be the first to say that it wasn't consistent amongst all parents' experiences, even within the school that I'm a parent of. So I think that there would have been a lot of grace extended to the CPS teacher that I interacted with, if at least there was a minimal social emotional check-in. However, parents found themselves facilitating these interactions and these touch points on our own. And so, you know, I don't want it to get into a critique session, because I don't think that's fair. We're all navigating new terrain, but that was my experience.
You know,
that's our critique for you. So Dr. Stovall, I mean, I don't mind critiquing, so I say the things that people quote. But Dr. Stovall, she touched on some good points, talking about the social emotional aspect. And so we could start around those early years, that kindergarten through third grade. We know the importance of that. And then if we look at the gap between Black and brown children as opposed to their counterparts, what effect is that going to have on these little children as they get older, from your perspective?
I think it can have an effect, but just what Ms. Smith said, we're all in this really trying situation where there's really not a lot of options, and the choices pretty much are all bad, right? And I think it's important for listeners to just take into account, if they don't have kids, or if they are not familiar with schools, that this is an unprecedented situation. So because it's unprecedented, it's going to be tougher to engage. Now, I think there's a couple of things that folks can do in the meantime when we talk about school systems, because a lot of times what we think about in early development, to your question, that kindergarten through third grade space is that early development space. And it's also a space where you're in community with other students. Right? So now when that's interrupted, I think more so than your academic content, the real piece is that interruption of that human contact. And that's something that is much harder to get back, if at all, right? So I think that's the thing that I feel is the most important, that is being missed in that K through 3 grades, and that just that space of being in community with each other, learning about each other, and then figuring out what those steps are going to be as you move forward. Now, if and when, you know, knock on wood, that this thing finally ends and we're in community with each other, I think there's going to have to be some real work in terms of recouping that, especially.
What do you mean by work? What do you mean by work?
When you talk about K through 3, this is something, and I think, people may consider me, I know this is a family affair. People may consider me going left to left on this, but this is something that I think we got a real opportunity to interrupt in a real way. So we know that in K-12 public schooling and a lot of private schooling, your testing begins in third grade. What would it mean to get rid of that, right? Because we know that testing is rooted in eugenics. It really tells us how well a student is doing at a certain point of the day, right? And some of us have seen this stuff in schoolhouses where we get a baby's a test and give them some cookies to try to keep them awake, and then we don't give them anything to drink, right? So we choking the babies and asking them to take a test, right? So it's senseless, right? So I think this is a real opportunity to revisit standardized testing and whether or not we should even be having testing. And I'm full on proponent that we should not. And now we have to think about, what does it mean to be back in community with each other? Because we know testing third graders has no longitudinal effect as they get older, right? It's not going to tell us anything. So if we know we're already doing something that isn't going to tell us anything, why are we doing it in the first place? And I think this COVID moment allows us to rethink that.
Brother Garcia, from a teacher standpoint, you said you've been teaching 3 days. Have you noticed a difference, like in attention? Let me give you an example. I think I have some form of ADHD. It's hard for me even to sit here on this StreamYard for an hour. So I can't imagine, and I'm on Zoom calls all day, and the shit stresses me out sometimes. So I can't imagine some young people having to sit there and listen to their teacher through a screen. What is that like? Tell us a story about what that's like, or add something to it.
So I try to think about it in the same framework as when I'm in front of the classroom. right? You've got to do something in order to get their attention. I don't want to call it an act, but as a teacher, you know that you have to put your personality out there in order for them to get, to have some buy-in in your class, all right, to make those personal connections.
So what are you doing?
Sometimes I talk about myself. Sometimes I crack a joke here and there. It's those little things. It's not something overt, because you want it to be organic. You want the situation to present itself, and that way it's actually an organic interaction. If you try and do something gimmicky, they'll pick up on it. I mean, I deal with teenagers, and some of us here have been around teenagers a lot, and still have teenagers, right? So we know that they will see through you, and they will eat you up and spit you out if you let them. And so I think you need to have organic connections. Now, how do you do that through a screen? Through eye contact, a smile, making sure that you're calling them by their first name, giving some personal touches, whether it's a personal anecdote, something that still makes this some sort of human contact, because as Dr. Stovall mentioned, our humanity is at risk here. Okay. And so we need to, as teachers, I mean, it's not something you sign up for when you're a teacher, but man, it's part of your job. Okay. You're trying to preserve those social, emotional contacts, those things that make us human. And so for me, those first couple of days of school, it was about just trying to do that. And I will say that the school that I worked with, they actually pressed that for the first week. The first week, they're like, look, we don't want you guys to give them homework, to test them, to quiz them yet. We want you to make those social connections, to make them buy into your classroom. And so that's what I'm trying to do. That's what I'm trying to do this first week of school. And hopefully I can continue to do it, for as long as I need to.
And shout to Mr. Garcia, because, man, Murray, to your point and what Mr. Garcia just laid down for us, man, that is hard as shit, man. I mean, like, that is not a game, man. That is real work. And it should not be discounted. And that type of stuff, like, to do that end on end, if you got high schoolers, you doing that for 5 periods, that's not a game. And that thing, so we got it on both sides. So young folks trying to zone into this, and then teachers trying to keep energy up to even engage young folks. I mean, like, it's hard, it's tough. And I think we should acknowledge the challenges in this moment.
Go ahead, Doc.
I was going to say one thing that I want us, I'm not trying to depress all y'all, but one thing I want us to consider as we continue with our conversation is, in the spring, it was an emergency. Many people thought, many schools hoped, everybody hoped, but they actually made plans to come back in person in the fall. And in my mind, I'm thinking we could be in this setting for 3 to 5 years. So it's one thing to say, what do we do for a semester or 2? What do we do for more than that? In other parts of the world, rich parts of the world, some schools are actually meeting successfully. So I want to say something about that and ask our callers as we consider what has to happen going forward to remember this. So the Scandinavian countries in particular have come back in their K-12, but they've come back in a way that we can't. Their class sizes, first of all, are already smaller than ours, and they reduce them even more, which means you got to bring in more teachers, you got to have more space, you got to spend more time. So one of my colleagues said, there's no short-term solutions for long-time neglect. In other words, if you F up long enough, you can't just fix that stuff quick.
Trust.
So we have, in CPS, for example, and other public schools in our region, when you have a class size, when you have 40 third graders in a class, I argue you ain't doing it's hard to do any teaching there anyway if you got 40 third graders in the class. So our class sizes should have always been 10 to 12, always. But now during this time period where we're in an emergency, we have to insist on that. We have to hire more teachers. We have to put more teachers' aides in terms of the Zoom. or whatever remote platform you're using. I'm not sure that it can replace at any age in-person teaching, but if we want to minimize the harm, we have to do that. We heard on the news that everybody's trying to put in hotspots, but that's very, if you're sharing one computer in a family with 3 or 4 kids, what are you really doing? And if you live, my internet goes down. I live on the South Side. It's a little iffy on the South Side, and I pay big money for my internet. So what I'd like to hear is, what kinds of things should our communities be insisting on and fighting for? Because we might be here in January, or worse yet, in 2021 in the fall, we might be sitting right here talking about what's going on with these remote classes.
I think one of the things, and this is, Doc Murray, this is an important piece that you touched on. In the late 90s, there was an organization here in Chicago called the Center for Community Technology. Yep. They had a whole policy space where Chicago was trying to model itself after Portland. So Portland is one of the few full free Wi-Fi cities in the country. So Chicago actually, and it's an interesting point, because Chicago has the infrastructure set up, it just hasn't activated it in terms of the agreements with the capital conglomerates and the internet companies like Comcast, RCN, or whoever to actually operate it, because they would have to share the space. So the infrastructure is actually here in Chicago to become completely Wi-Fi, but, and in terms of wireless and free, but it's the political will to actually activate that network. So the infrastructure is there. So I think that's something that should be on deck. Another thing that should be on deck is, like you said, multiple devices for families with multiple children, right? We have to think about that, because to your point, and this is where we really have to get and think about this succinctly. Remember, before COVID, 60% of CPS students access the internet outside of school via phone.
Yep.
Right. So this thing around putting that in context, and then post-COVID, 60% of CPS students never logged in.
Wow.
Right. So this thing around really kind of putting that in context, we have to think about these infrastructure networks that are readily available and can be up and running, but now actually doing that work. I think that's a critically important point, because now what you see, this long-term problem has been disinvestment and the removal of infrastructure from places in Chicago like the South and West Sides, right? So I think it's important for us to really think about that in terms of what can be done.
So let me ask you all this, and I'm gonna keep it real. If we know that 60% of the students didn't log in, 60% of the students access the internet through their phone, these solutions, we need some short-term solutions and some long-term solutions. When you throw racism and everything into the structure and how they treat Black and brown kids, what you said is cool, but what are some, what's the easier solution? We're not going to get, the people are not going to get a state of Illinois, Chicago free internet. They're not going to put laptops in all the kids' homes. They're not going to give them hotspots. So what are some other things we could possibly do to help, combat this issue? Because to me, this K through 6th grade, this is going to be a lost generation. They're going to be behind the lot. So any solutions?
As a parent, and this perhaps it sounds pie in the sky, but I feel like especially when it comes to children who come from underserved communities, I feel like there is no other quicker option than for the community to create networks within itself, right? And so I'll put it like this. I'm someone who works with children. I'm someone who has multiple degrees. I'm someone who was in a unique situation where my lifestyle did not change from COVID, right? So economically, I did not take a hit. I had the ability to give my 2 children very focused attention for the spring semester, and I almost went crazy and they almost went crazy. And I say, when you take all that into consideration, if someone from my position has to say, I have to get creative, right? I have to say, well, what family do I trust that we can leverage? What are you good at? What resources do you have? What resources do I have? And how can we get creative to make this work? And I feel like if I have to do it as a person of relative means, then I understand that there are some barriers that may prohibit people of lesser means to do it. However, I don't see any way around the community getting extremely creative and leaning on each other and saying, what do you have that I don't have? What can you do that I can't do? How can we create our own safety net? Because the cavalry not coming, right? Mm-hmm. So I really honestly don't see any way other than communities at the ground level and parents at the ground level creating these creative networks amongst each other. I think that's being done perhaps to less nuance than people may prefer. But I think that really giving underserved parents, Black and brown parents, the tools to be able to do that and to be resourced, I think that's a valuable strategy.
So let me ask you, Brother Garcia.
If I can jump in real quick. So I think what we're looking for here is something, right, that could continue on after there is a solution to COVID-19, whether it's some sort of therapeutic, right, or whether it's a vaccine. Because what we want is some sort of solution that we can take during this time and continue it on in our work, right? Something that people can say, oh no, it's time to end this. COVID's done. You guys don't need this resource anymore. So in thinking about that, what I'm seeing here is, once again, it's the investment in the educational system. We know already from study that student to teacher ratio makes a difference. The smaller the class size, all right, the better the students are going to do. Why? Yeah. Why is the reason that sometimes you have private schools that do better than public schools? It's because of the cap of the class size. You can't compare 40 students to 20. Yeah. I mean, that's 2-to-1 ratio right there, as far as how much time people are getting to educate the student, right? So that's a solution. We can increase the amount of teachers. Districts can hire more teachers right now in order to lower the amount of the student to teacher ratio. So you can Zoom, instead of having to Zoom with 35, you can Zoom with 15. Just as myself as a teacher, it's really magical. I went to go buy myself on Saturday. I bought myself a little 32-inch TV. That's what I'm looking at you all right now. Okay, and the reason I bought it is so I could fit 35 faces on this screen at once, and so I could see them. Okay, and so what I'm saying is, instead of forcing that upon us, let's make an investment to lower the class size. That's something that can carry on past COVID. Let's make an investment on the infrastructure of the schools. We know some of them are falling apart. So the reason why that some of these districts can't open up is because the schools aren't ready. You can't even open a window in some schools. Right? Yep. How is that possible that we can get some decent ventilation in schools? Yep. So I believe that it's those types of investments that are needed here. The problem is that when you invest in a person, right, it's hard for people to conceptualize the return on that investment. What they don't understand is the better education someone gets, we know the less they're going to cost the healthcare system because they're better educated. Right? Mm-hmm. They're able to get a better job. Which means that, once again, all these other health issues are going to go, maybe not go away, but there will be a smaller percentage of them having health issues. They'll be able to contribute more to the economy of the community. So, I mean, it's an investment. It's an investment that will realize itself, or that will have a return in 10, 15 years. So people need to understand that they have to be patient with that educational investment. There is no quick fix.
Mm-hmm.
But how do we do that? Who do we put the pressure on? Do we put the pressure on CPS? Do we put the pressure on the mayor, the governor's office? How do we get people? Go ahead, Doc.
No, I was just going to say, to your point, all of the above, right? that all of those spaces that we named, right? It should be pressure on the mayor, right? It should be pressure on local officials. It should be pressure on the governor in terms of making that thing happen. And what Ms. Smith said, I think, is critically important. So, Murray, you and I being real close in age, there was a time when we were coming up where a lot of community schools were started literally by people who were thinking about what does it mean to educate folks in their respective locales. So in this COVID moment, what I've learned a lot more about is mutual aid. Right?
Yes.
So this idea of saying exactly to what Ms. Smith said, look, who has this? Like, we see this all the time in power outages in New York. I don't know if anybody's ever seen this, right? The power goes out. Somebody says, all right, look, who cooking meat? I got a grill. We gonna figure it out. Like, look, son, you bring this, I'm gonna bring this. We gonna figure it out. We gonna distribute it to the block, right? So I used to see this in New York all the time, right? And this is what we know. So if we think about like block club associations, so my next door neighbor is a science teacher. Right. So if we think about these block club spaces, and again, these are in the meantime solutions, but I think that mutual aid allows us to think about our own resources that we have access to, and then what we can do with those resources. I think that's a really important point because it gets us away from this kind of dependency on the state, who in many cases always proves that it does not have our best interest at heart, right? So I think it's really important to think about that in very different ways. And like from these two sisters who run an arts organization on the north side called Kumba Links, they've really been teaching me a lot about how they think about mutual aid and this thing around this little bit of money. And they operate off this philosophy. Say, look, we got a little bit of money, but everybody's going to eat. Now we got to make sure that everybody eats. So I think this moment puts forward a different way of doing and knowing. And when we are faced with this, and something that we've seen before, right? So this is something that my grandparents used to do, where when me and you were in high school, in the summers, I used to deliver baked goods down King Drive to all my grandmother and aunt's friends. But they would do this thing where I never got money. So I would deliver a cake and they would like give me a hammer, right? So I deliver a pie and then I get a saw, right? But this thing was, okay, right, take this to such and such. We gonna make this. We got to do this little bit of work over here. So take this to such and such. We're gonna make this, do it back. And then I would actually, in delivering that, I would also take it back to the folks. So it was this whole thing because Black folks coming up in the Great Migration didn't necessarily have a lot of money, but they had skill and they had some resources that they were willing to share because they knew that meant the benefit of the broader community.
But now, so I want to bring some reality in here, okay?
So go ahead, say your reality, because I want to say something too. Go ahead.
So this self-help has always been a part of both of our cultures. However, if you don't have enough sugar and flour to make that cake with, you ain't gonna make no cake. I don't care how much, there's only so much you can borrow. So let me just say this. The government, and this is really important because we got an election coming up. The government belongs to us. And the fact that we let the government screw us means we have the wrong people controlling the government. So these public schools are our schools. We put a lot of our money and a lot of our sweat and tears in those schools. So I'm all for people helping each other. I think that's a good thing. But everybody doesn't have the resources that some people on this call have. So people they're going to work at 7 in the morning and then working a second job. They're not at home trying to struggle, to help their kids get something remote. They're not, they can't be it. If the kids are going to have a roof over their heads, those parents are going to be at work. And a lot of times you'll have the high school student trying to sit down there with the fourth grader and get them involved in whatever's going on. So we're in an emergency. So I do think the self-help, understanding what we want and determining for ourselves what our communities need, I definitely agree with that. But if I'm sitting here without any bread and there's a whole bunch of bread over there in that store, then we need to organize to go over in that store and get the bread. So what I'm saying is this country is a rich country and we are screwing our kids before COVID-19. And now that we have COVID-19, we're about to screw them even worse. And what we need to do is join political forces so we can insist on a situation that can be as safe as possible, that'll change over time, and pool our resources from all around the country. I want to take some resources from those rich schools, those rich public schools too.
And they ain't giving that up.
Well, you have to take it from them. So let me be clear. I'm not saying this happens easily. What I'm saying is, let me be real with you.
Right,
if we don't do this, if we don't take money for our children, we will lose a generation. We will lose a generation.
So let me ask you this, Doc. You know, you got multiple degrees. You went to medical school, and I hate to be a pessimist here. You know, with racism and all that shit going on, this generation is almost lost. These kids aren't from the discussion we had today and what we know, these kids aren't having hands-on learning activities. These young children, what's the curriculum like with online learning? If I'm a high school student and my parents aren't here and I want to, you know, potentially be a medical doctor, which means I have to prepare at a certain young age, online is not giving me the tools and stuff that I need where I might even get into a decent college to pursue that. So all these, and I agree with you, all these things are positive things, but realistically, in terms of the government, in terms of us going up there and gangstering money from these rich white folks, chances of that happening are slim. The chances of my neighbors coming out and you know, organizing, hey, let's do this for the kids, let's do that for the kids, plus the fear of COVID are slim. The chances of people like Brother Garcia who gets a TV 32-inch and comes out his pocket so he can look at each of the 32 kids, other teachers aren't doing that. Who's holding those government agencies and things, and who's holding them accountable for what's going on with our children? How do we?
So we have to walk and chew gum at the same time. Think about Hidden Figures. Okay, those Black people were barely able. Most people weren't even able to finish grammar school. The few that made it on, they came back and taught. They were mistreated. They were underpaid, but they worked together. So those sisters in Hidden Figures, Sunday at their church, they were organizing tutoring sessions for those kids. The problem we have is we have COVID right now.
That's right.
So some of those communal things we're not going to be able to do safely. But that doesn't mean we have to work on two levels. We have to cooperate and help each other out. But we also have to work on the political levers too. So while they were trying to do tutoring on Sunday evenings after church, and while they were trying to raise money to send Johnny off to college because he was really bright, they also were spending time fighting the system to make sure that things got better. Don't forget you all are too young, but Prince Edward's County, when they integrated the schools in the late 50s and early 60s, they closed the whole public school system down for 5 years.
Yep.
Okay. They closed it all down.
Yep.
And when that happens, you have to fight that, but you also have to find a way around it. So I'm not really against any of the self-help things that we said, but we have to work together. You have to work on 2 or 3 different levels at once.
So my question to everybody is, I feel like one thing that COVID has shown us is that even in light of this public health crisis, the government does not feel, pushed to act unless they see a cost benefit or a cost detriment to doing so, right? And so how do you put a cost to the loss in human capital, right? And the loss in what is occurring in this generation? Because I feel like no action is going to occur unless we can put a quantifiable, unless we can put a monetary value to it, right? Because that's the only thing that has compelled our politicians, at least in this iteration, to act right now. Hopefully, perhaps we'll get a different administration in November. But I feel like right now, if we can't communicate it in a loss of dollars or cents, then our expectations should be low. And perhaps that's pessimistic. So I guess I'm just posing that to like your thoughts about that. I don't know.
Yeah, I think the thing, and exactly to your point, this idea of now, because I don't necessarily think it's this thing around putting value, like monetary value on it as much, but this kind of loss of human potential, right? I think folks can understand this, right? Because if the government, multinational corporations realize that no one can come and do the work that they need to happen, then they will actually mobilize themselves and make this pivot to now say, okay, we gotta figure this out. Like we gotta put some things in order that will make sure that at minimum we can have this happen. Because to your point, these large multinationals are starting to see that, right? Especially when we talk about food delivery systems, right? So the thing around really, when we start to think about this, and there's no more folks left to be recruited, right? Yep. You can't go to San Luis Potosí or Guanajuato and bring a whole family up because look, everybody is saying like, look, this is not safe for anyone, right? Mm-hmm. So now this thing around really putting that in context. And I think now, just as we see commercials showing people with masks or what have you, capitalism is forced to make a pivot, right? That's a good point. And that thing around there, and it's, late stage capitalism has been forced to make a pivot. And I think in that pivot, folks are starting to figure out what actually is working. Because to Dr. Murray's point around what's happening in Scandinavia, right? So what Scandinavia schools, if you think about Denmark, if you think about Sweden, Finland, and Norway, what they did is they just activated a system that they already had in place. They just dropped a few more things on the back end, right? Mm-hmm. So that system that we're seeing now was already in place. Like, if you look at countries like South Korea, right? You all saw this thing in the summer where one dude goes to 8 different bars and they find this dude in 8 hours. Right?
Yeah, right.
They literally find this cat in 8 hours, and they like, look, homie, you gotta sit down. This is you can't leave the house, right? But this thing around having infrastructure where you can do that, right? And I think this is the moment where capitalism makes this pivot and figures out that it can't sustain itself, without doing something in ways that are different.
So
I definitely go ahead, Brother Garcia.
So I agree. The capitalistic system is going to have to make a pivot, and they tried to start it with sending everyone back to school, right? Mm-hmm. They tried to do it, which I understand. Look, I get it. Many of the families that I serve in my district, they work 2 jobs, okay, and their kids are, their kids need to go to school. All right, not only because there is no one home, but they know that, they are below the poverty line. They're going to get their 2 meals, possibly a third from the school. They know when it's cold outside, they're in a heated place. When it's hot outside, they know they're in an air conditioned building, right? So every teacher wants to be in the classroom. We do. We really do. Like, we are afraid, right? Okay. We're not accustomed to being frontline workers. Or that's just not that, or else we would have signed up to be cops or an EMT or something like that, right? But essentially, we want to be in the classroom. So how does that happen? We need national guidance. We need statewide guidance. The guidance that we are receiving from the state is so filled with loopholes. It is so vague that the districts, every district, private, public, we are all struggling and floating out there on our own. And every district is afraid that they're going to be the district known as the district that had an outbreak with COVID.
Yep.
So
I want to touch on that when you're done. Go ahead. You finished?
Yeah, no. Because the thing is, like, capitalism has to pivot. Make a national mask mandate. I know we have a statewide mandate, but we need something there. We need something that's going to protect everyone, so people feel safe about going out again. And so, I mean, that touches on the educational system as well.
So let me say this, just to kind of repeat what you all are saying, and I agree with it. One of the simplest things we could do is put a lot of pressures on these corporations to invest back in these neighborhoods, meaning getting hotspots, getting laptops, put a little pressure on some of these entertainers and athletes to support us and support these young children learning. But you touched on something when you talked about the lack of information you got as a teacher when it comes to the standards of protecting yourself with COVID. So let me ask you all this as we're running out of time, because you all teach and you have children. In January, if they say, in order to go back to work, in order to go back to school, your children K through 12 must be vaccinated. In order to teach at the universities or high school, you must be vaccinated. How do you all feel about that? Because, and let me say this I'm not a medical doctor, but I will say, usually when it comes to vaccinations, it usually takes about 3 to 5 years, because you have to test people, you have to look at the side effects. So now, in a year, they're going to say, hey, we're going to shoot your babies up, and we're going to shoot you up to get back to normal. How do you all feel about that?
Yeah, I mean, it's the realest. I mean, that is the crux of the issue, right? Because
are you gonna get it?
Yeah, for me, I wouldn't, because I have a couple of means by the ways in which I think I can potentially avoid it, because I wouldn't want to be taking something, to your point, right off the bat, right? I would need to feel more confident in it. Now, this thing around, Ms. Smith made this point earlier, there will be people without means who are now forced into very difficult situations, right? And I'm deeply concerned about this, right? Because when we are giving folks treatments that we don't really know what longitudinal effect that they have, we got a problem, right? So I think that's something that we definitely have to think about, right? Especially with folks who are immunocompromised. This is a real situation. I do not want to downplay what you've put forward. I think that is a serious situation that we now have to contend with.
So Sister Smith, what you gonna do with your little babies? You gonna get your little babies?
Or you can take it if you want to, but I was gonna go next.
No, I just don't want, because she got little babies. She's in high school. What you gonna do with your? And it's a mother. Us fathers, we act a little bit different. So your little precious babies, in order for them to, get out your house and go away for 8 hours, so you can get a break again, you gonna give them that shot?
No, I wouldn't. And if I could be as candid as possible, it might simply for me come down to anything developed and approved under this federal administration, I just don't trust. And that's just where I'm at with it. I believe in vaccinations. However, I think that there would have to be a lot more evidence of the benefit of them, the long-term benefits of them, before I would opt into it. And I'm not saying that it would be years, but it wouldn't be in January.
Brother Garcia, and you got, so for you, are you gonna get vaccinated yourself as well as letting your babies get vaccinated?
And if it came out this January, you're saying, right?
January. I mean, they're talking about coming back in January. So.
Let me say first, I don't believe anything's coming out this January. I truly believe the soonest we're getting something is maybe a therapeutic in the summer. And that's being optimistic. Okay. Mr. Murray, that's a tough question. I think I would take it before I give it to my babies.
So
I think
we're okay with distance virtual learning then? And the cons with that, you're okay with that? You're okay that your children might be behind a little bit?
because of the privilege that I have, you know, and so because I believe you have to recognize your privilege, right?
Yep.
Because of the privilege that I have, I know I can afford to keep my babies home, you know, and help them as much as I possibly can, whether it's extra tutoring or whatever. So for people who do not have my privilege, I can understand getting the vaccination right away for their children,
right?
And so it makes me choke up. It really does, because I would do it first before I had my babies do it.
I give you a hint, brother Garcia. Anytime you get tired, just send them to their retired grandmama's house. You know what I'm saying?
Yes, I can't do that. They are high risk. They are high risk.
That's true. So
Doc
Murray, I need to ask you a question because we're running out of time.
Yeah, but you're not going to get. Go ahead.
No, it's going to be quick. I know you're an advocate. Well, I shouldn't say advocate. I know you understand the importance of vaccination when it comes to the flu shot. As you harass me every year for the past 30 years to get that, and I refuse to do it.
Oh, you got to get that.
No, I'm not taking that flu shot, man. I'm not with that.
Don't waste our minutes here. Go ahead.
So, Doc, go ahead. Explain to us the importance from your standpoints of vaccination and close now, because we almost, your last statement.
I know we got a few minutes. So let me be clear. First, people are right. Now most people are not in a position to carefully evaluate the vaccines and how they're developed. Fortunately, the entire world is working on this, and there are other countries that I trust more than this one to be developing a vaccine. So I'm going to leave that aside for the moment, and I'm going to give you this perspective, because pandemics change everything. When I was a little girl, way, way, way back in ancient times, I was a little girl when polio vaccines didn't exist. And so I was a little girl where every summer, parents would be fearful to let their children go and play because they were afraid they would be infected with polio, which would, to remind people, would paralyze you. You might have to have braces on your legs. So when I was a little girl, you could see children living inside of an iron lung that would breathe for them because we didn't have a polio vaccine. And I remember as a little girl standing in line with my mother and my younger brother and sister for over an hour in Cleveland, a long line, as we were one of the first cities to try the oral Sabin polio vaccine. So when you understand history and you understand how many people died from, when I was young, they didn't have no measles vaccine. Okay. You understand how many children died from measles, even though it was a very common disease. So what I'm here to tell you is that a safe and effective vaccine saves lives. And so we have to have experts, and I'm not quite that expert in vaccines, but I am expert enough to be able to evaluate the different vaccines. We have to have experts to evaluate how safe and effective these vaccines are. So in that spirit, I will say, if we get a safe and effective vaccine, we'll be having a meeting here about how come our communities can't get access to it. That's what we're good. So don't get confused. Okay. If we have a safe and effective vaccine, we'll be fighting for access because they'll be off doing vaccinating who they want first.
That's what I'm saying. They don't care about us, man.
But we care about us. So again, I don't think people should be discouraged, but I think collectively as a community, we have to come together, learn as much as you can about COVID, understand what's going on, try to separate. I can't predict whether one child or another might get sick. And so think about what we need to solve the problems for large numbers of people, because that's where our hope lies with this kind of pandemic. If we can keep a lot of people safe, then the chances of you and your loved ones getting sick and dying decreases tremendously. And in terms of this education system, this is going to hurt our kids. They're going to take a hit. I don't care that Federico has. He didn't say this, but his wife's a teacher too. So you got two little girls in a house with two teachers. Okay, so they're in good shape. But we have to worry about this. We have to worry as the economy continues to fall. Unemployment's at 15% now. It's going to go up. We have to worry when they start evicting people. We have to be prepared to fight against the bad effects of this pandemic. We've only begun to see them. I don't care who wins in November, those bad effects will still be there. And we have to be willing to stand shoulder to shoulder and fight for what we know is reasonable.
So let me as we get ready to close out, let me go around and let everybody say something, to the end. But I do want to say this before I let you give your closing remarks. It worries me, it scares me, and I'm very, very sad and disappointed in the government. I'm disappointed in American people, because I really feel as though a lot of brothers and sisters, especially in the hood, aren't gonna have the means and the resources to make sure that children can become successful. So we're gonna have a whole generation. I think incarceration is gonna go up. It just worries me, but I don't want to leave on a sad note. So, Ms. Smith, ladies first, closing remarks.
I guess the best way to close out my sentiments on this matter is just really to send good wishes and prayers and positive thoughts to the teachers who are going into the school year, as well as the students, right? And if you're not in either one of those categories, I just think as a community, find a way to stand in the gap, right? In a socially responsible way, right? I think if you see that there is a way that you can stand in the gap for a family or a teacher or support someone, if you've been blessed with the means, and I think right now is the time.
Brother Garcia.
So I'm going to preach patience. Patience for your loved ones, patience for your children, patience for the teachers. Patience is going to be key this year, and I think the other thing is to not forget to love one another. Keep those bonds strong. We need to keep our humanity, and let's not forget that. Okay, that sympathy, that empathy, that compassion. We can express that through a screen. Let's make sure we do that.
Love, Dave.
So again, y'all, and I appreciate everyone on the panel in this conversation. And I think the one thing that we have to afford to each other is a little bit of grace, right? So when things don't go necessarily right, to understand that there's another day. And I think the other part is that there's a very narrow window that we have right now to really push forward some things that we've been thinking about and trying to implement for some time, right? So the end of standardized testing, this idea of having space where we can now engage in more critical content, that we can move in these spaces that we've advocated for some time. And this COVID window, I believe, gives us an opportunity to push for that. And like you said, Murray, I am deeply concerned that those who have historically had the least will get even less. But I think this window allows for us to push to ensure that doesn't happen.
Doc Murray?
I agree with Brother Stovall. Everybody is hurting now. Everybody. Some of us are hurting more than others. But now is an opportunity, as every pandemic has presented us, to push for basic justice. So if we're clear about what we need to make schools work, then we need to push for that now. If we're clear about what we need to make healthcare work, we need to push for that now. Now is the time to push when the system is weak and the problems are obvious to everybody. And like I've been saying and will continue to say till November, register and take your ass to vote.
Yeah, we got to vote. We still gonna have some crazy people. And the last thing I wanted to say, I wish we had time to touch on it, but I enjoyed the conversation. I want to thank you all for coming on, but I want to discuss, so I'll just throw it out there, the idea of encouraging our people to take up trades as well. When we talk about education, and with this gap being there, there's going to be a gap. There's going to be a gap financially and educationally wise for us to get to higher learning in college and things of that nature. So we can't forget about the trades, and there's still some stuff people can learn at home and be successful with trades. So again, I want to thank you all for coming on. This was another podcast of Everything is Public Health, sponsored by Young Health Professionals. We'll be back next month, same time, same channel, and we'll just have conversations and have fun. So enjoy the day. The playoffs are on. I think I'm gonna go grab me a shot of cognac, some Remy XO, and kick back and watch the game. Dave, I'm on Remy XO now, man. Give me a bottle, Jack.
You know how it go.
Right. But for real, I want to thank you all for coming out. And that's
Thank
it.
you. Thank you.
Yep.
Thank you.
Bye-bye.
Have a good one.
Bye.
Bye.